There is not.
Then I would just ask to be allowed to address the Senate for a brief period of time.
The senator is recognized.
I just wanted to touch this afternoon on two issues. And one is the issue of Social Security, which is life and death for many, many millions of Americans, as well as the issue of Medicare and Medicaid. And the main point that I want to make, and I make this as a member of the Budget Conference Committee, is the American people, regardless of their political persuasion, Democrat, Republican, independent, conservative, progressive, whatever, the American people are quite united in stating that they do not want cuts to Social Security, Medicare, and Medicaid, and they do not believe that we should balance the budget on the backs of some of the most vulnerable people in this country. According to the latest National Journal United Technologies poll, 81% of the American people do not want to cut Medicare benefits at all. 76% of the American people do not want to cut Social Security benefits at all. 60% of the American people do not want to cut Medicaid benefits at all. And this is just one of many polls that are out there. And what the American people understand is that millions of people are hurting in today's economy. Poverty, number of people living in poverty, an all-time high. Median family income going down. Unemployment, much, much too high. People are hurting, and we cannot make devastating cuts on the social safety net, which is life and literally life and death for so many of our people. And I did want to mention, Madam Chair, that I worked on a petition drive with a number of grassroots organizations throughout this country, and they include Credo, Daily Kos, Campaign for America's Future, Social Security Works, Democracy for America, Progressives United, Move On, Other 98, U.S. Action, and the Alliance for Retired Americans. And within a pretty short period of time, less than a week, we have gotten over somewhere around 500,000 names on a petition which says very clearly, do not cut Social Security, Medicare, and Medicaid. Do not balance the budget on the backs of some of the most vulnerable people in this country. And the other point that I would make when we talk about the budget is at the end of the day, people do believe that the deficit is too high, and we should be proud, by the way, in the last 4 years we've cut the deficit in half, but it is too high. But what the American people also say that is what is much more significant to them is the economy and the fact that we have so many people who are unemployed. And I would just point out, as somebody who believes very strongly, and I speak as a former mayor of Burlington, Vermont, who believes absolutely that when your infrastructure, your roads and your bridges and your rail system is in need of enormous investment, where we can create millions of decent-paying jobs, rebuilding our crumbling infrastructure, that what the American people are saying is, yeah, we have got to create jobs. And I would just point out that according to a March 3rd, 2013 Gallup poll, 75% of the American people, including 56% of Republicans, 74% of independents, and 93% of Democrats support, and I quote, a federal jobs creation law that would spend government money for a program designed to create more than 1 million new jobs. So again, across, people say, well, we're divided in America. Well, you know what? In many ways, we're not quite so divided. American people say don't cut Social Security, Medicare, and Medicaid. The American people say the most important issue facing our country is creating jobs. They want the federal government to do that. In this body, we are divided. But among the American people on many of these issues, Republicans, Democrats, Independents, they're not quite so divided. I would also point out that when we talk about unemployment, an area that does not get anywhere near the kind of discussion that we need is youth unemployment in America. And I will tell you, Madam Chair, that as horrendous as unemployment is for anybody of any age, it is so terrible for the young people who are graduating high school and graduating college. What we say, all of us say to the young people in this country, don't stand on street corners, don't do drugs, go out and get a job, create a career, make it into the middle class. And yet, real unemployment for young people in this country, for youth in this country, is somewhere around 20%. 20%. Among African-American young people, it is over 40%. And I don't hear the discussion here in the Senate about the need to create the millions of jobs that our young people desperately need. So when they leave school, they can go out and create a career for themselves and make it into the middle class. And I worry very much about those young people who don't have that opportunity. I would point out, Madam Chair, that in an interview published on October 1st, 2013, Pope Francis said, and let me quote what the Pope said, "The most serious of the evils that afflict the world these days are youth unemployment and the loneliness of the old." And he's not, of course, just talking about America. He's talking about what's going on throughout the world. "The old need care and companionship. The young need work and hope, but have neither one nor the other. And the problem is they don't even look for them anymore." And I couldn't agree more. We cannot turn our backs on the elderly. We cannot cut Social Security and Medicare. We cannot turn our backs on the young people. They need to be able to be given the opportunity to have decent jobs and make a life for themselves. Madam Chair, I also wanted to say a few words about a piece of legislation that just passed the Health, Education, and Labor Committee. I am the chairperson of the subcommittee on primary health care and aging. And I want to thank Chairman Harkin and Ranking Member Lamar Alexander, who were co-sponsors of the Older Americans Act legislation that just last week came out of committee. This is a bill that some of us have been working on for several years. The Older Americans Act is an enormously important piece of legislation for senior citizens all over this country. The bill that came out of committee in a very strong bipartisan way has the strong support of over 50 national organizations representing tens of millions of Americans, including AARP, the National Committee to Preserve Social Security and Medicare, the National Council on Aging, the Alzheimer's Association, and the Meals on Wheels Association of America. I won't go into all of what this bill does. I don't have the time to do that, but it deals with the issue, very important issue, of elder abuse and making sure that seniors in nursing homes get the care and respect that they are entitled to. It deals with a long-term care ombudsman program. It places an increased emphasis on evidence-based programs. It addresses the changing nature of senior centers in America, prevents fraud and abuse, focuses on home care and nutrition services. There's a lot in this bill that I think is quite good, and it's a step forward. Here is one of the problems that we have, and Senator Burr of North Carolina raised it, and appropriately so. The issue is that we are seeing in this country in general a migration of folks from northern parts of the country to the south. That's not a new issue, including many seniors. And what Senator Burr was arguing is that he thinks the current formula is unfair, that it does not take into account that kind of migration, and I think he has a valid point, which we want to address. But here is the other point, and more important point, I think. Since 2006, the last year in which the Older Americans Act was reauthorized, the U.S. population over 60 has grown by 20%. As the baby boomers age, every single state in this country has seen their senior population grow. Yet, and here is the important point, federal funding for this legislation is the same today as it was in 2006. That's $1.8 billion. Funding for the act in terms of real inflation accounted for dollars has decreased by more than $250 million during that period of time. So you have a growth in the senior population. You have a decline in real dollars going into the needs of seniors through the Older Americans Act, and this is a very, very serious problem. And you compound that problem with a migration from the north to some states in the south. What's the solution? Well, I think the solution is pretty simple. if we understand that the Older Americans Act is an enormously cost-effective act. You don't need to be a gerontologist or a physician who deals with senior citizens to understand that when a senior is malnourished, doesn't get the nutrition that he or she needs, that senior is more likely to break a hip by falling, that senior is more likely to get sick, end up in the emergency room, end up at the hospital at great cost. Everybody knows, no debate about this, that when seniors have the companionship, when they have the nutrition that they need, they are less likely to end up in the emergency room, they're less likely to end up in the hospital, and we can save money. Study after study shows that investing in programs like the Older Americans Act, and that is the Meals on Wheels program, the congregate meal program, employment opportunities for seniors, dealing with elder abuse. When you invest in those programs, you save money. You not only, from a moral perspective, make life better for seniors, you actually save federal money by preventing other bad things from happening. So I would hope that our committee and members of the Senate can work together to say that increasing funding for the Older Americans Act is not only the right thing to do for millions of Americans, it is also, in fact, the cost-effective way to go. And I think if we can increase funding, we can deal with some of the issues that Senator Byrd has raised. What I will not support is making drastic cuts in certain states like Iowa, New York, or Massachusetts in order to increase funding in other states. What we have to do is protect every state in this country, because there is no state where programs like the Meals on Wheels program do not already have long waiting lines. So what we need to do is invest in these programs, and when we do that, I think we will have done a very, very important thing for seniors all over this country. And with that, Madam President, I would yield.